Recording and reporting. Definitions. Documentation. Documentation is the permanent recording of information properly identified as to time, place, circumstances and attribution. Documentation is the written, legal record of all pertinent interactions with the client assessing, diagnosing, planning, implementing and evaluating. Record. Record is a clinical, scientific, administrative, legal document which is related to the care given to individual, family or community. Recording. To write something down so that it can be used or seen again in the future, to produce a record of something. Reporting. It is oral, written or computer-based communication intended to convey information. Reporting is the verbal or written communication of data regarding the client's health status needs, treatments, outcomes and responses. Purposes of recording and reporting. 1. Decision making. 2. Communication. 3. Reimbursement. 4. Legal accountability. 5. Education. 6. Assessment. 7. Planning. 8. Research. 9. Audit. 10. Historical document. 11. Quality assurance. 12. Vital statistics. 13. Health service planning. 14. Diagnostic and the therapeutic orders. 15. Accrediting and licensing. Decision making. Records play an important role for making decision. Based upon the previous data, future planning, decisions can be made. Communications. Records are tools of communication among the members of the health team to promote continuity of care among departments throughout 24 hours of care and during the entire hospital stay. Reimbursement. After viewing the client's records, the reimbursement from the medical agency may be done for client care. Cost awareness has increased the emphasis on what care is necessary and no care is to be implemented. Education. The student in health discipline like medical, dental, BPT, nursing views the client's record as an educational tool in their clinical experience, and these records can frequently provide data for care studies. They can learn a great deal about the clinical manifestations of particular diseases, specific investigations, effective treatment modalities and clients' responses towards treatments. Legal accountability. The client record is a legal documentation and it is usually administrable in a court as an evidence, especially in medico-legal cases. The record safeguards the clients, nurses, doctors and the hospital. The record should document clients at risk and safety measures implemented. Assessment. Nurse and other healthcare members gather assessment data from the client's records by studying client's history and in initial assessment and comparing this data with additional subjective and objective information that has been obtained. Current health status and progress towards goal can be determined. Planning. The nurse use baseline and ongoing data to plan nursing care. Research. Records serve as a reference material for research work. Nursing research results in new approaches to client care and it increases professional knowledge. Historical document. As there are specific dates of entries on the client's record, this has a great value as a historical document. Many years later, information regarding clients' healthcare behavior might be pertinent. Quality assurance. As part of quality assurance program, healthcare agencies periodically conduct chart audits to determine whether or not the care provided meets the established standards of client care and financial information about which service generates revenue, etc. Audit. An audit is a review of records. Auditor needs records for doing auditing. Vital statistics. Records are used especially for assessing mortality and morbidity rate. Diagnostic and the therapeutic orders. Nurses are responsible for ensuring diagnostic and therapeutic orders that are entered in the client's record and implemented. Health service planning. Data taken from the client's record point out the health problems of the country and it also provides a baseline in which local, state, national and international services are planned. Accrediting and licensing. Record keeping is basis of good patient care. Thus, it should be integral to all practices. Type of records. Ward records. Nurses' records. Students' records. Staff records. Academic and administrative records. Ward records. Patient's clinical record. Instruction book. Admission record. Discharge record. Census record. Call book. Complaint book. Movement register. Visitors record. Indent book. Round register. Attendance record. Linen book. Drug maintenance register. Treatment record. Stock and issue register. Death register. Medical/nurses records. Nurses assessment sheet. Change of shift record. Standardized care plan. Nurses report book. Nurses progress notes. Treatment chart. Graphic sheet. Student records. The list of record is application forms and other reports concerning selection and admission, such as references, medical reports, including mark lists, certificates, and results of written test and interview at the time of selection. Admission register. Cumulative health records. Class attendance and leave record. Clinical and field experience, student rotation. Internal assessment register, both theory and practical. Mark list, state council/board results. Records of extracurricular activities. Practical record book. Permanent cumulative student record, student details, examination and results, theory hours, practical experience, marks, rank class for each student. Student evaluation, internal practical and theory. Staff records. Application form. Copy of letter of appointment and any subsequent letter showing change in status. Job description/functions. Record of the staff members. Educational qualification. Previous experience. Any short-term educational courses attended. Membership in professional societies and activities. Contribution of articles to journals. Holding office in organization. Participation in seminars, conferences, etc. updated every year. Periodic evaluation or progress report. Leave record. Health record. Academic/administrative records. Philosophy, purposes, and curriculum. Course content and course plan record for each subject. Record of academic requirements. Rotation plans for each academic year. Record of committees. Record of the stocks. Affiliation records. Records of educational programs organized for teaching faculty and students. Annual reports. Written policies. Statement of budget proposal and allotments. Copy of brochure. Inspection/accreditation record. Minutes of committee meeting. Photograph/video/paper cuttings of important events. Computerized records, floppies, CD. Guidelines for recording and reporting. Effective documentation requires use of common vocabulary, legibility, neatness, factual, accuracy, completeness, correctness and organization. Legibility, written information must be easily readable, without any chance of error. It is best to have computerized record. In case of any mistake occurs, draw one underline through the erroneous entry and state the reason for the error. Never forget to do initials and date of correction. Accurate, for hospital setting as well as research purposes, accuracy is very important quality of documentation. Use medical terminology with correct spellings in descriptive terms. Avoid using judgmental language such as good, poor, BAA, seems. It is best to write clients verbatim also. Avoid using clues. Completeness, always make complete sentences. Never leave space in between lines. Even pictures can be drawn if needed at appropriate place. Never forget to document the information omitted or refused by the client. Avoid using local abbreviations or symbols. Try to write full form of the word. Currentness, keep the documents up to date. If any change occurs in hospital policies, timings, patient care, etc., it must be written immediately. Organized, start any entry with hospital name, patient name, IPD no, gender, diagnosis, date and time. Write information in chronological order such as assessment data, observation, intervention, and evaluation. Documentation should be done in timely fashion to avoid omission and duplication of pertinent data. Recording should be done as soon as the information is collected to avoid missing data. It is not good practice to wait until the end of shift to record findings of all clients. Late entry can be done as per hospital policies and also in conditions such as chart was not available, chart was with client in special procedure lab. Information was documented on the wrong record. Confidentiality, this is very important to treat all client information in a confidential and professional manner. It is a legal document and should be available to the client's healthcare team. It is nurse's important responsibility to protect the privacy and confidentiality of client interactions, assessment, and care, as documents are used for education and research purposes. Members of these educational and research teams are held to the same standards of privacy protection. Factual, a record contains descriptive and objective information about what nurse gained through her senses. Document the findings with supportive factual data. Avoid words such as appears, seems, properly. Documentation need to clearly explain the nurse's observations of the client's behaviors. It is also best to document the client's exact words within quotation marks. Methods of recording. Records and report must be accurate, factual, complete, current, and confidential. There are many methods used for recording such as narrative charting. This is a traditional method of recording nursing care. It is a story format that describes the client's status, interventions, treatment, and client's response to treatment. Nowadays it is replaced by other formats because of time-consuming writing, difficulty in retrieving the data and disorganization in the flow of care. Source-oriented charting, this is a descriptive recording done by each member of healthcare team on separate records. Its advantages and disadvantages are same as of narrative charting. Problem-oriented charting, this is a method of documentation that places emphasis on client's problem. Here each member of health team contributes to a single list of identified client problems. This problem-oriented medical record, POMR, helps in coordinating a common plan of care. It has 4 components. Database. Database contains information regarding assessment, i.e. history, physical examination, nurse's assessment, laboratory findings, ongoing assessment till discharge, dietitian's assessment. Database is the basis for identifying client's problem and planning care. Problem list. Based upon the database, list of problems, physiological, social, spiritual, cultural, environmental, etc., is made in chronological order. Nurse use NANDA terminology in writing client's problems as nursing diagnosis. The list of problems is revised as new problems arise and others are resolved. Initial plan. Based upon the identified problems, care plan is developed with client's active participation in setting goals, outcomes, and interventions. Progress notes. Health team members will evaluate and record the progress of clients' problems. Information can be expressed in various formats such as SOAP or SOAPy. S. Subjective data. O. Objective data. A. Assessment. P. Plan. I. Intervention. E. Evaluation. R. Revision. Pie charting. SOAP format is developed on medical model. Pie, problem, intervention, and evaluation. Charting has a nursing origin. The key components of this system are assessment flow sheets and nurses' progress notes with plan of care. Clients' problems are labeled and numbered. When interventions are implemented, problem number is identified. This system incorporates ongoing plan of care into the daily documentation. Focus charting. Focus charting is a method of identifying and organizing the narrative documentation of client concerns. It includes data, action, and response. Focus charting is not restricted to clients' problems but also to identify all concerns including results of diagnostic test. Focus charting uses a columnar format within progress notes to distinguish the entry from other recordings in a narrative note. Charting by exception, CBE. It is a charting method that requires nurse to record only deviations from pre-established norms. This charting is established to overcome the recurring problems of lengthy, repetitive notes and to enable the identification of trends in client's status. CBE has three components. Flow sheets, highlights important findings and define assessment parameters and findings. Reference documentation, is related to standard of nursing practice. Bedside accessibility, is related to documentation forms. Reporting. Reporting is the verbal or written communication of data regarding the client's health status needs, treatments, outcomes and responses. Reporting facilitates clinical decision-making, continuity of care and coordination among health team members. Types of reporting. Change of shift report. In this type of report, on-duty nurse information about assigned client. Also known as end-of-shift report. Example, nasogastric feed is withheld for a client as tracheostomy is planned. This information needs to be conveyed to the nurse on next shift, so that she should provide continuity of care. Purpose. To provide continuity of care among nurses who are caring for a client. Change of shift report includes following points. Background data gathered from client interaction and assessment of the functional health patterns. Medical and nursing diagnosis of priority problems. Determining the client's risk problems. Current changes in the client's health status, increase or decrease in physiological, psychological, environmental needs etc., and change in treatment, new medication, omitting medication, lab test. Effective interventions or treatment of priority problems, including laboratory and diagnostic results, client's physiological response to blood transfusion. Progress towards expected outcomes, priority problems, teaching or discharge teaching. Modifications in the plan of care. Client on family's fresh complaints. Oral report helps in asking direct questions and clarifying explanations. As nurse has to take many responsibilities, change of shift report must be conducted quickly and efficiently. But simultaneously must reflect the points written above for providing comprehensive continuity of care. Example. Background information, Mr. X in bed 12, orthopedic ward, a 30-year client of Drive Y is scheduled for an amputation of right lower limb this morning. He had gangrene formation. He was admitted last night. This is his first experience with surgery. Assessment, Mr. X expressed difficulty falling asleep last night. He asked several questions about surgery. In night he called for assistance several times. Nursing diagnosis, 1. Anxiety related to inexperience with surgery. 2. Risk for body image disturbance. Teaching plan, he asked relevant questions about surgery. Nurse on evening duty explained postoperative routines. I reinforced information with client early in night. He stated that he felt less anxious, also observed so through vital sign monitoring. Treatments. Client received tab diazepam 5 mg PO at 10 p.m. Psychological support was given following mental catharsis. Client was awake at 6 a.m. and stated he slept well. Family information, client wife accompanied him last evening until the end of visiting hours. She is in room this morning. Discharge plan, Mr. X is a very active and responsible person at home. He is a farmer by occupation. Mr. X is concerned about how he might react to amputation. I suggest making a referral to the rehabilitation consultant early. Priority needs, Mr. X is relaxing in his room. Written consent for surgery has been signed. All preoperative procedures have been completed except for his preoperative medication, antibiotic, which is due on call to the operating room. Transfer report. Such reporting is done in case client is transferred from one ward to another ward to receive different level of care. For example, client transferred from recovery room to medicine ward when the client no longer requires such intensive services. To facilitate continuity of care, transfer report may be given by phone or in person. While giving transfer report, nurse must consider following points: client's name, age, gender, primary physician, medical diagnosis, surgery if performed, summary of progress up to the time of transfer, current health status, physical, physiological, psychosocial, current plan of care. Any critical assessment or interventions to be completed shortly after transfer helps the nurse to establish plan and priority of care. Any special precautions, such as isolation etc. Need for any special equipment, tracheostomy set. The receiving nurse can ask questions or clarify explanations about client's status. Sometimes written documentation must include record of information reported. It facilitates the continuity of care. Incident reports. Incident reports are used to document any unusual occurrence or accident in the delivery of client care, such as client falls, medication error, needle stick injury, accidental omission of ordered therapy. An incident is any event that is not consistent with routine operation of a healthcare unit or routine care of client. When an incident occurs, the nurse involved in the incident or the nurse who witnesses an injury completes an incidents report. Some institutions have incident report form. Nurse document only an objective description of what was actually observed and follow-up care that occurred and does not specify in the medical records that an incident report was prepared. In case client or visitor is involved in an incident, physician is notified and he determines the actions to be taken to determine whether client suffered. In case client is suffered, physician documents the examination and findings in the client's medical record. Points to be written in incidents report. Record the date, time, and place where the incidents occurred. Describe specifically what happened in concise, objective terms. Describe objectively client's condition at the time of incidents, measures taken by nurse, physician at that time. Do not interpret or attempt to explain the cause of incidents or blame other. Submit report as soon as possible. Keep a written account of incident report. Importance of records and reports. Decision making. Records play an important role for making decision. Based upon the previous data, future planning, even decisions can be made. Planning client care. Records are very helpful for planning nursing care to the patients. Communication. Records and reports are very important for conveying the information to the employees, employer as well as to the public. Legal documentation. Records are very helpful for the legal purposes, especially in medico-legal cases. Education. Records are helpful for teaching the nursing as well as medical students. Medical students learn from the previous records of the patients. Research. Records are the secondary source for data collection. While conducting research, investigator did the recording of all the activities he/she performed during data collection. Auditing. Auditor needs records for doing the auditing. Without records, auditing cannot be successful. Quality assurance monitoring. Records also used for monitoring the quality assurance. Vital statistics. Records are used especially for assessing mortality and morbidity rate. Financial billing. For embarrassment purpose, records are very important. Accrediting and licensing. Record keeping is basis of good patient care. Thus it should be integral to all practices. Principles of good record keeping/writing. As records serve as legal document, they should be written clearly, accurately, appropriately, and legibly. All entries should be signed by the individual who writes them. Care is to be taken not to make any errors on the records. If anything is crossed out, it should be dated and initiated. Records should be written in chronological order as to date and time. While giving medicine, treatments, note the exact time and date on which they are carried out. Records are written continuously with no blank spaces. If any space is left out, it should be crossed out, dated and signed. Lengthy corrections of records are written as amendments. Each page of the records should be properly identified with the name, age, IPD no, bed no, ward, date, etc. Use only standard abbreviations. Records should be truthful, brief, and complete. It should include all the services given to patients, the observations made on the patients from day to day, and the results of treatment, etc. Principles of maintaining records. There must be standards framed for record keeping that focuses on content quality. Records should be for a specific purpose which should be clearly understood. Records should contain only relevant information and records should not be duplicated. Items on forms and in registers should be conveniently grouped so as to make their completion as easy as possible. The wording should be easily understood, and where doubt is likely to arise, instructions to facilitate interpretation should be included. Records which are required by the teaching staff should be easily accessible to them. Persons responsible for maintaining records should be aware of their particular responsibility, and every effort should be made to keep records up to date and accurate. A simple system should be used for keeping records. It should be maintained on the proper forms and in the proper registers at all times. There should be an accurate supply of stationery to maintain records, the proper forms and in the proper registers at all times. There should be sufficient number of filing cabinets and appropriate equipments to operate a filling system which is simple and safe and requires the minimum possible time. There should be provision for periodic review of all records. There should be adequate, safe, and fireproof storage arrangements. Records should be audited by trained peer auditors at regular interval. Care of records. Records are kept under safe custody of nurse in each ward. No individual sheet is separated from the complete record. Records are kept in place, which is not accessible to the patient and family members. No stranger is allowed to read records. Records are not handed over to legal advisors without written permission of administration. All health team members are legally and ethically obliged to keep confidentiality all the information provided in records. All records are to be handed over carefully. Careless handling may destroy records. All records are to be arranged according to the hospital rules. It can be arranged alphabetically, numerically, with index cards, geographically. Records are never sent out of the hospital without the doctor's permission. Reference is made by separate sheet writing and sending to agency who requests for them. E.g. discharge summary, reference letters. Communication within healthcare team. Human being is a social animal. To socialize with others, we need to share overviews, beliefs, feelings, etc. This sharing is facilitated by communication. In medical field also, communication with members of health team is very important. It facilitates the process of patient care. Importance of communication within health team. As every member of health team gathers different information, it helps in planning comprehensive quality care of client. Sharing/communicating information helps to verify the clues, thus, reduces ambiguity. It also avoids duplication of efforts in collecting data. It helps the team members to benefit from the information others have collected. Sharing the collected information keeps all the members on one track/direction, i.e. achievement of goal. It avoids deviation from achieving goal. Communication ensures coordination between the health team members. In order to provide quality care, team efforts are required. No one health team member can improve client's health status independently. So, to provide quality, comprehensive care, skills and talents of all health team members are required. For example, nurses remain with admitted client 24 hours/day. Although doctor initiates the line of treatment, but he is dependent on nurse's observations, nurse's records etc. Before changing the line of treatment, he verifies client's complaints with nurse. Similarly, nurse look after the patient whole day but she can't prescribe or change treatment until she discusses with doctor, thus coordination is required in healthcare team and effective communication is channel for the attainment of this coordination. Communication is done through many ways. Face-to-face meeting, telephone conversation, records etc. Communication helps to keep all team members up to date on the latest information about a patient and the most recent development regarding the patient's progress. Communication media. Media is a way by which information is shared. Communication media commonly used in medical field are reports, consultation, referrals, patient round. Reports. Reporting is a means of sharing the brief information about the event that recently occurred. It is done to convey information regarding client's health status, i.e. progress or deterioration, e.g. fluctuation in BP, heart rate, ICP, CO2, O2 saturation. Reporting is also used to alert the members for the care of specific patients, e.g. urine out of client to acute renal failure, GCS of immediate post-operative client. Reporting may be done verbally or written. It can be done during whole duty timings as well as change of shift. In addition to patient care reports, there are some other reports and forms. Information about which is also shared among health team members, such as forms for requesting laboratory, X-ray form for consent, diagnostic test, form for recording the administration of narcotics, opioids, form for ordinary things, other supplies, complaint of any personnel. Consultation. Consultation means taking the opinion of some specialist/expert. Nurses usually consult peers, in-charge nurse, physician, specialized nurse regarding client's plan of care, progress, or about unusual problems. Nurses consult with physical therapist, social worker and also the all who are involved with patient's care. Even physician also consults other physicians, e.g. surgeon consults cardiologist, anesthetist to see patients and give opinion regarding diagnostic or therapeutic measures. Nurse will note the requests for the specialist consultations and specialist's report/remarks on client's medical record. Referrals. Referrals involve requesting services of another department within agency, e.g. client is admitted in orthopedic ward, where she is complaining of piles, prolapsed uterus. Thus, client is referred to surgery department and gynae department of the same hospital. Referring a client to another agency, e.g. client is admitted in orthopedic ward with complaint of backache. Through investigation he is diagnosed case of lymphoma. Client is referred to cancer specialty hospital. A referral system plays an important role in assuring continuity of care. Before referring client to agency, make sure that workers of that agency are expert and have sufficient information. It is the responsibility of nurse to assure that referral form is filled and complete. Within hospital, client's record should be available to the member of department to whom client is referred. Patient round. Patient round is best way of communicating information about client. Nurses are making round with in-charge nurse. Similarly, they make round with physician when visiting patients on a hospital. During round, information is exchanged, views and suggestions are taken regarding client's progress and plans are discussed for care. The gathered information is documented on one register also. Teaching rounds are also made to enhance learning experience of nursing and medical students. Sometimes teaching rounds collect information from client which seems very important for client, even helpful in changing the line of treatment. Common record keeping forms. A variety of forms are used to document client's health status, problems, interventions, response. These are the following. Nursing history. Nursing history or nursing assessment form is completed when client is admitted to hospital. This form includes a complete assessment of client to identify relevant nursing diagnosis. Information recorded on this form provides a baseline data which can be compared with changes in client's condition. Every hospital has different nursing history form depending upon standard of practice. Graphic sheets and flow sheets. Flow sheets have vertical and horizontal columns for recording data, times to show assessment and interventions. This helps to identify changes in client's condition. It is used to document vital signs, for therapy, routine repetitive care such as meals, weight. Flow sheets have small spaces for recording. These forms usually contain legends that identify the approved abbreviations to chart data. It is very important to fill the flow sheets, otherwise blank spaces reflects no intervention carried out. Flow sheets provides quick, easy reference in assessing client's health status. Very commonly these sheets are used in critical care units for all types of physiological data. Flow sheets are used as supplements to most documentations but not replace progress notes. If something on flow sheet is unusual or changes at significant level, a focus note is needed. If client's temperature increases suddenly, nurse completes focus assessment and record this as well as the interventions carried out in the progress notes. Nurse's progress notes. It includes client's condition, problems, complaints, intervention response to interventions and achievement of goal and outcomes. Progress notes include following forms. Nurse's notes. Medication administration record. Personal care flow sheets. Teaching records. Intake output form. Vital sign records. Diabetic flow sheet. Neurologic assessment. Standardized care plan. Standardized care plan includes following column. Assessment. Diagnosis. Expected outcome/goal. Planning. Rationale. Implementation. Evaluation. The standardized care plans are framed based on institution's standard of nursing practice. After nursing assessment, nurse prepares standardized care plan that is appropriate for client. The care plan is placed in client's medical record. Standardized care plan improves the continuity of care among professional nurses. Discharge summary. Here the emphasis is given on preparing client for an efficient, timely discharge from hospital. Nowadays, main focus of health professionals is early ambulation, recovery of client from disease, less hospitalization. However, it is important to ensure from whole health team that a client's discharge results in desirable outcomes. Discharge summary includes client's status at admission and discharge, a brief summary of the client's care, interventions, surgical and medical, and education outcomes, resolved problems and continuing care needs for unresolved problems, inclusive and referrals, client instructions regarding medication, diet, activity, treatments, follow-up instructions etc. Client's responsibilities as well as his family in client's care. Photostat copies of discharge summary are made. Original is handed over to client, duplicate is kept in client's medical record. Computerized documentation. Healthcare system has directed nursing leaders to develop computerized records in response to demand for clinical, administrative, and regulatory information. Nurses are using computerized system for supplies, equipment, stock medications, and diagnostic testing for some time. Computers facilitates speed in communication, accuracy in information, capability of information storage, data retrieval, data revision. Advantages of computerized documentation. It enhances systematic approach to client care through standardized protocols, teaching documents. It facilitates fast communication. It is cost-effective. Increases quality of documentation. Saves documentation time by avoiding duplication of effort. For example, physician documented the medication for client. Instead of writing it again, Physician's medication record will go immediately to pharmacy. As soon as pharmacy receives the order, client's medication record will be updated. Increases legibility and accuracy. A computer printout is easy to read and legible. As standardized documentation is done, accuracy is automatically achieved. Provides clear, decisive, and concise keywords on screen. Nurses have to select nursing choices. It enhances statistically analysis of data. Provides access to clients' other data such as laboratory results. Nurse uses critical thinking and makes decisions. Enhances coordination among health team members as information is quickly conveyed. It helps in coordination and integration among health team members. Disadvantages: costly installation of computer software. Problem in protecting clients' confidentiality. As in hospital everyone has access to computer recording. Transition to the computerized documentation presents both opportunities and challenges to nurses and practitioners. Mostly practitioners are reluctant to change from the comfortable pen and paper methods to advanced electronic system. Minimize legal liabilities. In hospital setting, like physicians, nurses are also involved in cases of medical malpractice, negligence, personal injury, disability, workers' compensation claims and insurance claims. Nowadays, public is very much aware of their rights. Every client expects best quality care in hospitals. Documents are the best black and white print which reflect the care provided. Thus, while documenting any word, nurse should consider the possibility that client's record may be submitted to the court as a source of information regarding client's condition and nursing care. Content written on records must be effective enough to minimize the legal liabilities. So in order to minimize legal liabilities, document should have following characteristics: factual, accurate, complete, legible, logically organized. Client's identifying information must be written on each page of the client's record. Nurse must ensure that she is writing notes on right client's record. While making entry on record, it must be started with complete date, month, day, time, and year. In case of wrong entry or wrong documentation, never throw the record. Incorrect information should be crossed out while retaining the original information. Don't erase or paste on chart. Instead write the correct information near this mistake notation. In case of inadequate space, write a note where correct information can be located. After writing, nurse must put date and sign initials. Nurse should never edit or delete the documentation done by other personnel. At the end of nursing notes, line can be drawn from end of text to end of right margin on line so that no one else can add documentation. Documents must be signed by the nurse at the end of entry. Never leave empty space between entries as someone else can add. Content of documentation includes assessment, nursing action, indication as well as client's reaction. In case any intervention is omitted, must write the explanation. While documenting, follow the hospital policies. While receiving verbal order, nurse must document the order, name, date, time of receiving order. It must be signed by physician within 24 hours in critical settings. Incident report should not be described in nursing documentation. As client has right to inform, every procedure must be explained to client. Written consent should be taken before operations. Nurses can be protected from laws if they follow policies and procedures while documenting.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.